behind you, doesn't it?
I did try it the other way, but that was rubbish as well.
Hi, everybody. We're live, but hello, everybody. Penny is just attempting. You can come into the light. Oh, there you go. That's a bit better. I'm just checking we are recording as well. I'm just asking my husband. There we go, the tech guy in the background. So hello, everybody. Welcome. This is Penny, and I'm going to start off by asking you, Penny, to tell us a bit about yourself, because obviously I know you, but the group are a bit new to who you are.
Yeah, absolutely. So I'm Penny Barnard. I'm a paediatric dietitian who works in a hospital on the South Coast. So I specialise in food allergy. That's what I probably spend 95% of my time doing, although I do specialise in gastroenterology as well. But nowadays, that's quite a small amount of my work. So each week I do an allergy clinic with a consultant and a specialist nurse where we do skin prick testing if appropriate. And obviously I do the dietary advice, and then I organise either ward or home food challenges if appropriate.
Yeah.
So that's kind of my NHS role. I do some freelance work as well, and a bit of private work. And obviously I've got my Instagram account where I try and support families as well with their questions and posts and keep them up to date with products, etc.
Yeah, which is really useful. And you are super experienced because you've also got a master's in allergy as well, haven't you? Which we did at the same time. And you know,
a long time ago now.
It does feel like a lot. Well, my little one is 8 now, and I was pregnant, if you remember, when I started that. And I think allergy dietitians, there are quite a few of you, but not many really specialist ones, I think, as specialised as you are. So we are lucky to have you in the group.
Yeah, I think there's lots of dietitians that do allergy. So lots of dietitians will, for example, see cow's milk protein allergy, non-IgE, lots of us. But then I think the numbers go down when it's dietitians attending allergy clinics. Yeah. And I think that's mainly due to funding in a lot of hospitals. So I'm quite lucky to have the post. Yeah.
And they're lucky to have you, and we're lucky to have you in the group, because what I have found over I think it's been open about 9 months, is that people will sometimes specifically say to me, like, well, how much protein is in this or that? And the thing is, I'm not a dietitian. I don't know those answers. Yeah. And although, like, roughly as doctors, we would know what sort of supplements and nutrients you might need, I don't know how to work that out or exactly what you need. And I think people are fooling themselves if they don't realise the importance of having dietetic involvement for allergy. Yeah. And we were just commenting just before we went live, weren't we? I was looking through the posts and commenting that some of the families that have commented have got multiple restrictions. And we were saying, well, the fact they're asking questions suggests that they don't have dietetic involvement to guide them over, like, where do you get your sources of calcium, etc.
Yeah.
Quite sad, really, because NICE guidelines would suggest if you've got multiple allergies, you have that involvement.
Yeah, absolutely. And I think there was a lady that was also struggling with the tree nuts with her little one. Yeah. And you would almost certainly think that she would be in an allergy clinic, so she'd have dietitian support somewhere.
Yeah. Yeah. And I think that's why we both do what we do. So we do give up our time, but because, like, I think many allergists just feel really passionate that we want people to be getting help, and we know that we can't do everything in clinic, so that's why we do this.
Yeah.
So there was lots to cover on the questions, and I'm looking at the screen. So we thought we would talk a bit about ladders and supplements and sources of milks and bits, and cover as much as we can. But we will talk more at the Allergy Summit on May the 15th, which the group now know about, but other people don't. And then ultimately in the course, the plan is to have you talk and Lucy, another dietitian, talk, and we will be covering in depth. I think there's going to be, it's 4 hours of dietetic modules, because we know it's the thing that people struggle with, the weaning, the ladders, the nutrients. So
So absolutely, it'll be great.
Yeah, it's going to be. I'm really excited. So I guess let's start off with, what sort of things do you notice that people struggle with being told about ladders and weaning, and when with the non-IgE allergies, particularly about the use of ladders?
So non-IgE, obviously the commonest one probably that I see every week is the to milk. So obviously I use the IMAP milk ladder, and I think that is commonly used around the country. However, there are other ladders that are used, and I think again from Instagram accounts, the Facebook group, parents do get frustrated when other parents have got a different ladder, being told different things. Well, I've been told to use malted milk. Well, I've been told to use this. Then step 2. Well, I've been told a muffin. Well, I've been told this. So that is very frustrating. So I think one thing that I always stress is that ladders are a concept, and I was lucky enough to be on the group that first wrote the MAP milk ladder quite a few years ago now, before it was updated to the IMAP. And it was a concept. It was a concept we put together because we knew that we needed to get milk into all these non-IgE children we were seeing with milk allergy that were just avoiding milk for months and months and months, and they weren't growing out of it. And we knew we had to try and develop something to try and help them build tolerance. So hence there was really the birth of the milk ladder. So it is very much a concept though, and I try to say to my parents, look, the ladder is all about building tolerance. We start at the bottom, we work our way up. At the bottom there's tiny minute amounts of milk in the foods we're asking you to give. It's heated, it's in a matrix, so it's with wheat, so the wheat kind of holds on to it a bit longer and makes it less allergenic. And then as we go up the ladder, we lose that. We have more milk in it, we lose the heat, we lose the wheat. And I know Lucy's going to talk a lot about the ladders in the course. And I'm sure she will go through every step. So I think my biggest frustration with and I think parents' frustration as well is they always come back to me and use the word failed. We failed the milk ladder. Okay, you haven't really failed the milk ladder, it just hasn't worked this time. But we can always do something to try again, something different. And I think lots of parents don't realise that when we're talking about milk allergy, milk has lots of different proteins in it. And sometimes I think there's just one protein in milk that my child is reacting to. Well, that's not the case. You know, your friend's child might actually react a little bit differently to something else in the milk, or predominantly something else. So what works for them might not work for your child. It might depend what formula you've been on, or if you've been breastfed, baby's been breastfed. So the different formulas have a different amount of the different proteins in. So they might have built tolerance to one more than the other. So there's lots of things. So I try and explain to them, okay, your child couldn't tolerate half a malted milk biscuit. Don't worry about it. Let's try quarter. Let's try a crumb, you know. And sometimes that's what we have to do. And I say, it doesn't matter how small the amount is. The fact that you've managed to get something in is an improvement. So if you know your little one's sat at nursery or music group or wherever and picks a crumb of biscuit up off the floor and eats it, if you've built his tolerance to that, he's not going to have such a bad reaction as he would if you hadn't got that tiny bit in. And I think sometimes it's just a matter of building their confidence to see that and to get started and move up the ladders.
Yeah. And I think one of the biggest difficulties people have, because so much is going on at the time we often introduce ladders, like they've started nursery, they're getting antibiotics, they're having vaccinations, is figuring out, how do I know when it's a reaction? And when do I stop? I think that's the biggest question. And you can see it across the group. Is this a reaction or isn't it?
And I don't always tell they quite often, for example, they would have been fine with a quarter, let's say, of a biscuit, half a biscuit, then they've gone up to one biscuit and they've had a reaction, so they tend to stop. Whereas I tend to say, well, try and take it back down to what they were tolerating. Maybe you've just gone a bit quickly. We've gone a bit quickly. So let's just slow it down a little bit and, see whether, his nappies, for example, return to normal on half compared to one. And let's just take it a little bit slower. So, I don't like to, if a parent said they failed, I don't like to leave it like another 6 months. I always try and modify what we've done. I said, okay, well, let them recover. Let's wait a couple of weeks, and then let's try a much smaller amount, and let's go slower, and see if we can work it in that way.
Yeah.
I think the egg ladder, for example, is much easier for parents. I think they find it much easier than the milk ladder, because it tends to be, split into two, really, doesn't it? Baked egg and then cooked egg, and it seems a lot easier for parents. And I think from the BSACI guideline, there's more guidance for them. We say, baked egg for 6 months, twice a week at least, and then we can move on to the next stage. Whereas the milk ladder, it's a little bit more subjective, as you say. Have they reacted? Haven't they reacted? And I think with milk allergy, generally, there's far more symptoms that they could present with, isn't there, compared to some other allergies. They could be miserable, they could have loose stools, they could have constipation, they could have a rash, they could have their flare in their eczema. There's just so much that could be a symptom, but as you say, could be anything else. It could be teething, could be something they've picked up at nursery. So many things going on.
And I think we've had a big shift in our mindset with the sort of seeing the immunotherapy coming through for like peanut, where we are trying to basically desensitize children. I know from what I've seen in the allergy world changing, it has gone from, okay, let's just try again in a few months, to, like you say, could you manage a crumb? Because actually that's the very start of the basis of building tolerance. And there's definitely much more talk in the allergy world, isn't there, of let's see what we can keep in. So almost really with children reacting, we've gone from just take everything out to, well, what could we keep? And it's a big mind shift, I think.
Yeah.
And
Definitely.
Not every experienced allergist is on board with that either yet.
No. I mean, in my career, obviously, I've been a dietitian now for nearly 30 years. And, 20 years ago, a child had a nut allergy. They avoided peanut, and they avoided every nut under the sun. Whereas now my role really in nut allergy is, okay, what can we get in, rather than we know what we have to take out. We know what the child has shown a reaction to. But let's look at the allergy test, let's look at the results, and let's see what we can get in, and let's work on that. So a total shift.
And I think you have to remember that as sort of families within the group, that when you're looking across social media, some people who do allergies are general pediatricians who do a bit on the side, and the level of experience is quite different sometimes. And unfortunately in medicine, we all have different opinions, and that's where the frustration lies. So it is tricky. So one of the questions we've had a lot through is, okay, well, they can't have milk and often can't have soya. What other milks could we use as the supplements? As the say they don't need a formula, but what other milks could they use in their diet?
So the ones that are old enough kind of not to have the formulas, there's either milks based basically on coconut, oat, nuts, or pea. They tend to be the four main ones. When you look at the ingredients list, you'll notice that a lot of them are quite low in calories and low in protein, and we're always advising that whatever plant-based milk, as we tend to call them, we opt for, it's always fortified. And we're usually, or hoping for, that parents pick one that's fortified with calcium, iodine, maybe B12, if they can. And again, the plant-based milks have moved on such a lot over the past few years that we find more and more that are fortified with all of those. The soya alternatives tend to be higher in protein. Then after that, it tends to be the oat ones that have the higher protein content compared to the coconut, which tends to be very low. The nut tends to be very low as well. And there's a couple of coconut ones that are moving on a little bit over the past few months. There tends to be more milks that are coming out that are branding themselves as follow-on plant-based milks, and the thing they're pushing there is the protein content, trying to get it more like cow's milk, and also the range of the fortification. So for example, cocoa super, you'll find that there's more vitamins in there. You know, there's the iron, which can be helpful as well.
Yeah. And I think
sorry,
I was just going to say, I think families don't realize, because they think these milks are healthy and good alternatives, and they see that they've got the vitamin D and calcium, so they think that's great. But I think what people don't always realize is why the protein is important, why, you know, things like almond milk are quite low in protein and what that might mean. And it's about growth.
Yeah, always about growth. And the more allergens you're avoiding, the more important that tends to be, because the more allergens we're avoiding, obviously the more restrictive the diet gets. We kind of get less sources of nutrient rich foods that we can use. So the protein content for growth tends to be more and more important. And obviously very important if the child is following a vegetarian or a vegan diet as well. And with food allergies, the protein content sometimes can be very, very difficult, depending, you know, on the foods they're avoiding in the diet as well. For example, you know, if they're vegan and also having to avoid nuts, it's very difficult to get a really good quality protein source going in there. Obviously, you've got the beans, you've got the pulses, but yeah, it can be difficult. But it's a protein that's, crucial really for growth and enough energy. So the protein is used for growth. Rather than used for other things. So it's important that, you know, the children, the little ones, are getting enough calories there. And again, the plant-based milks can be quite low in calories. So we're always looking for one that, you know, aiming for maybe 50 calories per 100 ml as a minimum. And that can be quite difficult, but they are out there. It's just there's so many on the market now, you know, UHT, fresh, but the ones based on coconut, pea, oat and nuts tend to be the ones that are used the most. And I would say, I think, from my clinics, the most popular ones are the oat-based ones and the coconut-based ones. It tends to be something around Oatly or similar, the supermarket owns similar brand, similar make, or the cocoa brand, or again, a supermarket similar thing. With, if they can tolerate soya, the soya alternatives tend to be higher in protein. And can be fortified, which you do still have to check, and slightly higher in calories as well. So if they can tolerate the soya, that's an added bonus.
And someone asked where, like, you would find natural sources of calcium in the diet beyond obviously the fortifying of the milk. What sort of
That's right. What one lady was asking, wasn't she? I think her little one was avoiding milk and soya,
and wouldn't take vitamins either.
That's right, wouldn't take vitamins. That's right. So I find one of the most useful sources of calcium, if the child's not taking very much plant-based milk, is a fortified bread, a bread that's fortified with calcium. So there's a couple that are milk-free but contain soya. So Hovis Best of Both, for example, contains calcium, and a lot of calcium. It's well fortified, and I only know of one milk and soya one, and I think this lady was milk and soya free, her little one, and that's Jackson's Bloom in Both, it's called. So it's only been out a couple of months, and that's highly fortified as well.
Do you spend your life reading products?
Yeah, it used to drive my children mad when we had to go to the supermarket. Can we just do the supermarket shop, Mom, and not look at all the
not look what's new on the market?
Yeah.
I was told there was some good apps. So I've told that there's one by Food Maestro, one for FODMAP, which is people with irritable bowel, but one for food allergies, where you can type in what they're allergic to, and then if you want bread, you can find the brands that would be suitable. Have you used those apps?
Yeah, I have used them. The key thing is just making sure it's up to date, really, and the new products are on the app. That's the only thing. One good tip, if you find the little ones won't eat the bread, is quite a lot of gluten-free products. So I look after all the celiacs in our area. So I do the same for all the gluten-free products. A lot of gluten-free products are fortified with calcium. So, for example, just off the top of my head, Warburton's sandwich thins, gluten-free sandwich thins, have got a huge amount of calcium in. It's really worth having a look at those if your little one doesn't like eating bread but might have a sandwich thin or something, or use them to make a little pizza or something like that. So bread is a good source of calcium. Obviously instant oats as well, so like Ready Break or the supermarket own, as does instant oats, for example, are a very rich source of calcium because they're fortified. A few other cereals are, but they are a few and far between. So, for example, normal Cheerios are fortified with calcium. Some of these products, so you have to be a little bit careful, like the Ready Break, for example, because they do have precautionary allergen labeling on them. So, for example, they do say may contain milk. So it really depends, again, if your child's got an IgE or a non-IgE, maybe whether that's important.
What's relevant for you. Someone just asked what the app's called. So the one I was saying was Food Maestro. Is it only for the UK? I don't know. Do you know?
I thought Food Maestro wasn't available anymore.
Not. The other one is Spoon Guru, isn't it? Which we can look. I'll look them up for people, and then we'll write them in the comments afterwards by the recorded.
There's one definitely that has about a year ago was withdrawn for some reason. I'm sure it was Food Maestro, but they might have bought another one out, maybe.
But I guess, like you say, people need to be keeping them up, and it depends on whether people are buying them as to whether, or downloading them, whether it's worth it.
I mean, they are useful for shopping. I do always encourage my patients to get into the habit of checking their own labels out and looking for themselves. It just eliminates another layer of error, really, as well. To get into the habit of reading the food labels, being confident at identifying on a food label what's good, what the child can have, can't have, and also getting the child to do it once they're at a certain age as well with you. So it just becomes habit forming, really.
It still says it's available, so I'll share the link.
Yeah.
One of the other questions was, because obviously we've heard about egg ladders, we know about milk ladders. Is there a soya ladder? Is there a wheat ladder? Do you use them?
Okay, so there is a soya ladder. I think the British Dietetic Association have a soya ladder. So the allergy interest group of the BDA, it's not available to patients though, but your dietitians will have it. In my clinical practice, I have to say I'm not a huge fan of the soya ladder, mainly because there's so many different reasons why we might be avoiding soya. So one of the most common reasons my patients avoid soya is because if they've got a milk allergy, it's suggested that they avoid milk and soya to begin with, particularly if they've got eczema, because they could have a problem with both. So if you like, they kind of get labeled as having a milk allergy and a soya allergy. Well, in actual fact, we might know they've got a milk allergy, but we don't know they've got a soya allergy. So I try and get over that by saying, when the time comes in weaning, when you would introduce bread, I just say use a bread that's got soya in it, as a first step of the milk ladder. And that's what they tend to do. And so then we just progress on with that. If they remain milk free, we might then move on to the soya yogurts, use soya milk in cooking to see whether they can tolerate it. And then if they want to use soya products, tofu for example, that's what they may well do. If the family is vegetarian and vegan and want to use maybe soya products more, we might do it in a more detailed way, but not people tend not to eat a lot of soya in their diet like they would milk or egg. So sometimes it's kind of less important to get it in the diet in big quantities.
Yeah.
That's one reason. Obviously, a child might have a non-IgE soya allergy. So, for example, we might introduce it and it really flares their eczema. So we take it out again. And if that's the case, yes, I might again use the soya ladder. So the soya ladder tends to begin with soya lecithin, which is an emulsifier. So you can get soya lecithin and sunflower lecithin and egg lecithin. So soya lecithin, the reason I tend not to use the first stage of the milk ladder, there aren't very many foods with soya lecithin that are kind of appropriate for children under 1, really. It's quite difficult to find a child-friendly food. So the first one is soya lecithin. Then it goes up to, again, we tend to model, if you like, the milk ladder. So it's still baked in small quantities with a wheat matrix. So then it would be like your bread, like I would tend to go into at weaning age when we introduce bread. And then it's still baked. It might be baked soya. So you might use soya milk in like a pasta bake or something like that that's been in the oven. And then similar to the milk ladder, you'd move out of the oven to unbaked. So you might still have maybe some cooked tofu that you've cooked on the hob, in the frying pan, etc. And then you would start to use, like you would yogurt and milk in the milk ladder, normal soya yogurts, for example, and then soya milk that hasn't been baked. Yeah. So you can do it very similar to the milk ladder, but unless my children are vegetarian, are going to have a lot of soya in their diet, I tend not to do it. I'd rather focus on the milk ladder, to be honest with you. Yeah.
Quite, yeah.
But if anybody wants one, their dietitian will have access to a copy. Yeah. As far as the wheat ladder goes, I never use a wheat ladder. I tend to I tend to just have a chat to the parent and see what type of wheat food they think their child will best fit into their diet, whether it's a breakfast cereal or whether it's bread, and then just start with a small amount and introduce it. And then we move on to number of portions a day, because we do generally have quite a lot of wheat in our diet in the UK. So, breakfast cereal or bread, toast at breakfast time, sandwiches at lunchtime, something in the evening. So we start small and then just build on whatever. It tends to be less about baking, etc. The matrix, because you've already got the wheat there anyway.
Yeah. Someone's asked a question that I think is probably important to clarify so that we don't put people at risk. So they've said, what's the difference between IgE and non? And therefore, are these ladders something? So her baby's got egg, milk, and soya, and she's put IgE level 3. So that's talking about her blood test. And would they then do a ladder? So I think that's important, because we don't want people to willy-nilly at home be doing this.
Yeah. So ladders were originally designed for only non-IgE allergies. So whether it be milk, soya, or egg, because non-IgE milk allergy has non-life-threatening symptoms. So although it might be unpleasant to have maybe diarrhea or tummy ache or constipation, they're not life-threatening. So it's kind of safe to do at home. So it gets away from long waiting lists, having to wait for an appointment to see your doctor, etc., to be able to do them at home. Very different to IgE food allergies, where you could possibly have a life-threatening symptom. So ladders aren't for people to do at home. for IgE. That's not to say that we don't do them. So very much now, we were talking earlier about how things change. Yes, so with my patients in clinic, I use ladders for milk, egg, frequently now, but only after assessment from the allergy team, after your skin prick testing, to see whether we think it's safe to do so. So
so the answers to the questions are that has to be guided by your allergist as to when the time is right, because they will know your full history, will be, have they had anaphylaxis? Does this need to be done in hospital? All of those things. Please don't do it at home if you have an IgE allergy without guidance, because that's quite the same. I'm going to end because it's going on, and you'll get all much more when you come and join us and the course. But thoughts on probiotics and which types of brands you recommend, if any?
Okay, so probiotics. Over the years, I have used them a lot in my clinical practice, I have to say. But way before really probiotic supplements for children were around. So classically, I would have used Yakult in children when Yakult really was the only probiotic around. Used to be great. Any child, with an upset tummy, tummy ache, bloating, diarrhea, constipation, all my celiacs, I would suggest they went onto a probiotic. Doesn't have to be all the time. And again, with my own children as well, the minute there was a mention of anybody at nursery with a tummy bug, right, where the Yakult came out, and there we will go, in it went, just in case. So I do like probiotics. So yes, there's nothing wrong with the good old-fashioned Yakults, but obviously now there's the advent of lots of different supplements for children. So the ones I tend to use in clinic are either Optibac, which I think one of the group said, but also one called BioGaia that I quite like. That comes in a drop, and also for an older child, a chewy tablet. And in actual fact, mom can take the drop as well during breastfeeding, or the chewy tablets. It's not just for your little one. So they're my two favourite, I have to say. That's what I tend to use. But any that your child will take really in a form that they will successfully take. And if one doesn't work, it might be worth trying a different strain of probiotic, because they all can vary. Some little ones might have had a prebiotic in their formula. So if they were on Nutramigen, for example, Nutramigen has healthy bacteria in it. So then when they come off that, some moms want to keep some kind of probiotic in the diet. So probiotics, I'm very for probiotics. There's not a huge amount of evidence to say. People always think, well, will it stop my child getting a food allergy? No, it won't stop your child getting a food allergy. We don't really know the involvement it does have, but equally, I think prebiotics, so there's more and more prebiotics going into everyday foods now. So breakfast cereal, for example, commonly, if you look at the ingredients list, there's things like inulin in it, chicory root in it, all of which probiotics. You have your yogurts, your kefir, all that have got different strains in, but also just having a good diverse diet of fruit and vegetables, high fiber, all of those foods feed the gut, feed healthy bacteria. So it's not just a matter, you don't have to have a probiotic. A diverse diet is good. That's what we really should be encouraging, and working at that all the time. I know it's very difficult. I know there's lots of little ones out there that are selective eaters or fussy eaters, or whatever people want to call them, and getting a diverse diet into their children when they have favorites or are quite selective can be difficult. But the more different foods we can get in has to be an advantage.
Yeah, sure. I mean, trying to get my 8-year-old to eat anything other than chocolate is kind of issue. But if people are interested, if you scroll down, and I can share the link again, I just contributed to an article for Yahoo Life, which does talk about all the different areas you could find. And actually, it was really fascinating writing it because I had to do some more research to make sure it was accurate. And actually, it flagged to me again the importance of fibre and all the different aspects it has. So it's quite an interesting article.
I always find fibre quite difficult in little ones because I'm also aware that too much fibre in little ones can cause them to have quite loose stools, and then that automatically gets blamed on a non-IgE food allergy, where in actual fact they've probably just got a bit of toddler diarrhea, and they've got, well, maybe they've got, they're just having too much fibre. And parents often say to me, oh, can little ones have too much fibre then? And I say, yes, very definitely, yes, they can. And again, you don't want it to affect too much fibre, tend not, to affect the energy content of the diet as well. The children need to be having enough energy and protein going in there, as we've already talked about.
Yeah, no, it's interesting. And I think for me as GPs, I just don't think we learn enough about this stuff. So, families come to advice about all those bits and pieces, and we are limited in what we know, which is why it's great to have you in the group. And I know you've been answering some questions for me as well and giving some answers, which is lovely. I will answer this or ask you this lady's question because she popped it on, but then we will end. So I've got clinic letters to write that are coming out of my ears. But so she said, she's got an 18-month-old with egg, milk and soya allergy, and she breastfeeds. Is that enough to cover her calcium, or does she need to be looking at supplementing with another milk for the calcium when she's still breastfeeding? Does she need to use, I guess, something in the diet as well?
Is she talking about her or the baby?
For the baby, I think. I mean, that's a good question. It could be for both. She's talking about for the baby, but of course we do need to think about mums that are cutting out milk from their own diet, and are they getting enough calcium?
So I would say almost certainly all moms would need to be on a calcium supplement. The calcium requirement of a breastfeeding mom is huge. And we know when we're breastfeeding or we've got a baby, we don't spend enough time on ourselves anyway. And often that goes to probably not eating as well as we should, or making time to, we have meals that we can just eat with a fork, etc. So absolutely, definitely, mom should be on a supplement, a calcium supplement. Baby, we know that in the first year of life, the baby's calcium requirement is a lot higher than when it gets to 1. So at 1, it drops down. So in the first year of life, baby's calcium requirement is 525 milligrams per day, and then it drops down to 350. So normally, as long as baby is breastfeeding well and they're taking a good amount of formula milk, we know that once weaning starts and calcium-rich foods go in, that should be enough calcium in the diet. So as long as baby's breastfed, which they are, they're not on formula, and they're breastfeeding well, and mom is on a supplement, so the quality of her breast milk's good, that should be enough.
Yeah. And we do talk a bit about still thinking about what sort of milk could you use to pour on cereal, because it's important that children get used to the textures, to seeing it, so that if, and hopefully when they outgrow that milk and soya allergy, they will adapt to using something. So looking at oat milk or almond or all the things we talked about would still be good to add in, but you don't need to specifically supplement it.
No, you don't need to supplement. I mean, I tend to, with my patients, even the breastfed, all my breastfed babies, I do suggest to mom that maybe they have a tin of a milk-free formula in the cupboard, because they really never know when they might need it. If mom's ill, has to stop breastfeeding, or they need to supplement it for any reason, or to use in cooking, they do have a formula to use as well.
Okay.
So whether that's Nutramigen or Optimal Pepti, something like that. There's a few of them out there. Sometimes I get into trouble by saying that have a tin of formula in the cupboard, but you never know.
We'll tell you off for that in the group.
When mom's going to be ill and she can't breastfeed, and then I've had moms panic. They for whatever reason they can't breastfeed, for whether they have to go onto a medication, etc., or for whatever reason, for 48 hours, 72 hours, and there's panic. What's baby going to drink?
So, I definitely think it's always thinking about what's right for your family. What do you want to do?
I
think it's just what you're probably highlighting is that when you need a prescription formula, A, you've got to get hold of a doctor, and B, to order them into a pharmacy, it takes 48 hours at least. So it's not as easy as suddenly mum's ill and you need something. So it's not saying you ever need to use it. You don't have to go down that route. It's just, it's almost a bit like having some Calpol in the house in case you need it.
Absolutely. And some parents just keep the prescription, you know, they never cash it in, or they just know the names of the ones they would ask for, rather than having to try and find a dietitian last thing on a Friday evening and then try and find their GP and then get it prescribed and then get it from the pharmacy. So we try and be a little bit prepared if we can. But so that's what we try and do.
Thank you, Penny. Well, I'm going to give a last plug to joining us on the summit. So the summit is totally free, although we will talk more about what the course offers. You don't have to join the course at the end. So that on the summit, we are going to have Penny and Lucy, so both dietitians. We're going to have Adette, who's a specialist dermatology nurse. And we are also having Francesca, who's a psychologist, to talk about the challenges of impact on mental health and how we navigate allergies, and also me talking, and a representative from Anaphylaxis UK and the Sadie Bristow Foundation. So it's going to be a great evening. The link is there, but I will keep sharing it over the next few weeks. If you can't listen live, it will be recorded and you can listen back at a later date. So it will be great. And we're super excited because I don't think anything like this has been done in the UK. So it's cool. Nothing like the course or anything. So thank you for your time. You'll see Penny in the group. So now you'll know who she is when she's answering your questions. And when she has time, bless her. And have a good evening, everyone.
Yeah, you too. Thanks. Bye. Bye.